once I am opening this rectus sheath anteriorly, here I am seeing another muscle also. See, this is one muscle, but at this level we are seeing small muscles, right? So two small muscles. These are nothing but the pyramidalis muscle. So once we have opened the rectus sheath, like this, now we are seeing the rectus abdominis muscle. This rectus abdominis muscle, on its superficial layer, it's having three tendinous insertions, 1, 2, and also third one will be here. These are nothing but the tendinous insertions of the intersections of this rectus abdominis muscle, which are nothing but the aponeurotic fibers of this rectus sheath going into the anterior side or on the anterior surface of the rectus abdominis muscle. What is the use of these tendinous intersections? The tendinous insertions, what they do is they will hold the rectus abdominis to the anterior abdominal wall, especially when we are putting a pressure on the abdominal wall, especially during the delivery of a baby or during defecation. When we increase the abdominal pressure, what happens is if these insertions, tendinous insertions are not there, the rectus abdominis will bow like this, like an arrow. When you are just take a small thin stick, if you just push both ends, what will happen? It will form an arch. There is nothing called as bowing. So in order to avoid that bowing of the rectus abdominis muscle, okay, these tendinous insertions are present. And these are the tendinous insertions which are responsible for the 6 packs in our body, 3 on each side, right? And now, coming to the position, rectus sheath, right? Already I said that the rectus sheath is present on either side of the rectus abdominis. Now I am just coming to the concept of the rectus sheath. Please remember that the rectus sheath is covering the rectus abdominis muscle completely on the anterior side, and it's incompletely on the posterior side. So this means that the rectus sheath covers completely the anterior surface of the rectus abdominis, while the same rectus sheath is incomplete on the posterior side. So to make you more understanding, to make it more easy, what I will do is this is nothing but the costal margin. Costal margin means what? The ribs. So this is the costal margin. So I will draw a line here. This is the level, one line. So I will name it as what? Part 1. And here gloves whatever she is touching is what? The part 1. And now the part between the costal margin, where she is showing the part 1, and up to the level of umbilicus. This is part 2, or up to below the level of the umbilicus, right? This is part 2, right? So just put your finger here. Wherever she 2 fingers, this is called as part 2. And now below that, here is part 3. Wherever she is putting her fingers is part 3. So now I am dividing this rectus abdominis muscle into 3 parts: the upper part, the middle part, and the lower part. Now if you take this, what is the structure? Umbilicus. What is the central part here? Pubic symphysis. Midway between the umbilicus and the pubic symphysis, where this girl is putting her finger, this is a region where you will be seeing one line called as the arcuate line. Arcuate line. I'll tell you what that arcuate line is. Now coming to the rectus sheath, right? This is the rectus abdominis muscle, which is covered by the rectus sheath, right? You can see the 3 tendinous insertions. One tendinous insertion is at the level of this umbilicus, then above the umbilicus at the level of the costal margin, right? These are the 3 tendinous insertions, right? I'll remove this one. Now anteriorly, already I said that the external oblique muscle is forming the aponeurosis, right? That is the aponeurosis of the external oblique. So below the external oblique, you are seeing the internal oblique muscle. Now try to understand what I say. The external oblique muscle is now coming towards the medial side, where at the level of the linea semilunaris, it is forming an aponeurotic sheath which is coming over the anterior surface of the rectus abdominis muscle. Anterior surface of the rectus abdominis muscle, which means that this external oblique aponeurosis is covering the anterior surface of the rectus abdominis over this region, that is the costal margin, over this region, that is the below, like in the second compartment, and also here in the third compartment, which means that This is the only muscle which is completely covering the rectus abdominis right from the top to the bottom. Right? That too on the anterior surface. Now below this I am showing you the internal oblique muscle. The internal oblique muscle is also forming, like the aponeurotic sheath. But see, the internal oblique, as it is coming to the linear seminerals, at this level, the internal oblique aponeurosis is divided into two lamina like this. Two lamina. So one is called as an anterior lamina, second one is called as the posterior lamina. Now the anterior lamina of this internal oblique muscle is joining with the aponeurosis of the external oblique muscle, and now it is covering this compartment. So only second compartment. So upper side you are not seeing, lower side you are not seeing, right? Now if you come to the next one called as the transversus abdominis muscle, this transversus abdominis muscle is also forming an aponeurotic sheath, but it is now, this sheath is not splitting, it is going like this. So which means that, the anterior surface of the rectus abdominis is completely covered by the aponeurosis of the external oblique muscle, and in the middle compartment it is covered by the external oblique and anterior lamina of the internal oblique. Now I am coming to the third compartment. In the third compartment, what has happened is, as you know very well, external oblique is already present. Below that, already I said that the internal oblique has divided into two lamina, right? Anterior and posterior lamina. And if you come just towards the lower part, what is happening is, at this level, this internal oblique, again it covers, right? It is covering. Now it is extending here at this lower level, and it is coming towards the anterior side. Which means that now outer layer is external oblique, below that is the anterior lamina of the internal oblique, and this fascia transversus abdominis, what I said, no, it is going below, right? But in this second compartment it is going below. Once it is coming to the third compartment, the same fascia, that is same aponeurosis of the transversus abdominis again is coming upwards. So this means that in the lower compartment you are seeing anterior, you will be seeing external oblique aponeurosis, internal oblique aponeurosis, and the transversus abdominis aponeurosis. So 1, 2, 3. In the first compartment, you are seeing only anteriorly, you are seeing only external oblique. 2, you are seeing external oblique, internal oblique. 3, you are seeing external oblique. This is the rectus sheath on the anterior surface. But now I wanted to show you on the posterior surface. So to show you on the posterior surface, what I'll try to do is, I will just try to slowly lift this rectus abdominis muscle. Cut it. Right, okay, I came down. So now midway between these two, right? What I am trying to do is, this is the rectus abdominis, I am lifting it properly. Now I have lifted it, right, completely. Now I just said that midway between the pubic symphysis and what? The umbilicus. I said that there is some line, right, called as the arcate line. You can see this arcate line here. See, I am just trying to see. This is the arcate line, you can see. This is nothing but the arcate line, which means that at the third compartment, at this compartment, what has happened is, the internal oblique muscle, the aponeurosis of the internal oblique muscle, after covering this rectus abdominis, the posterior lamina of the internal oblique, I am not telling about the anterior lamina because anterior lamina already has covered the anterior surface. The posterior lamina, what it is doing is, after covering this rectus abdominis, here at the level of this arcate line, this posterior lamina is forming a free margin like this. See, this is forming a free margin. Can you see this free margin? Called as the arcate line, or the linea semicircularis, or otherwise also called as the fold of Douglas. So this is the importance of this. So which means that at this level, the aponeurosis of the internal oblique has ended at this level. So below this level, you are seeing that the same rectus abdominis, whatever I am holding this part, is now directly resting on the fascia transversalis, which is nothing but this fascia. What you are seeing, see, fascia transversalis. Okay. Whatever fascia you are seeing, that will be the fascia transversalis, which is covering the abdominal wall or the abdomen, right? So this means that in the lower 1/3, here at this level, the rectus abdominis is directly lying on this fascia transversalis. Now, if you are coming to the upper 1/3, quadrant 1. In this quadrant 1, what has happened is, like you can see, I am just trying to, like separate this, like rectus abdominis here also. And just try to separate it slowly. Right, okay. Once I am just separating it here, what you are seeing is like this is a coastal margin. So already I said that the rectus sheath is deficient and posteriorly. So now again 1, 2, 3, 3 compartments. 1, 2, 3, 3 compartments are there. Now I am talking only about the posterior wall of the rectus sheath. Posterior wall of the rectus sheath in the upper compartment, that is, like above the level of the coastal margin. Now if I lift it here, there are no aponeurotic sheaths because the internal oblique was only covering in the second compartment only. So which means that in the upper compartment, what is happening is like the rectus abdominis muscle is directly lying on the 5th, 6th and 7th ribs, which means that in the upper compartment there is no rectus sheath. There is no rectus sheath. That's the reason why the rectus abdominis is directly lying on the 5th, 6th, 7th ribs. Right? Now coming to the middle compartment. If you see the posterior part, already I said that the internal oblique muscle, right, is now splitting into two lamina called as the anterior lamina covering the anterior surface, posterior lamina covering the posterior surface, right? And also I said that below the internal oblique there is transversus abdominis muscle which is not coming anterior, rather it is going posterior. So this means that in the middle compartment, the posterior surface of the rectus abdominis is covered by two aponeurotic layers, that is the posterior lamina of the internal oblique and the aponeurosis of the transversus abdominis. This is the second compartment. Now coming to the third compartment, already I said that all these three muscles came anteriorly. So again in the lower 1/3 of the rectus abdominis it is deficient. So the posterior surface lamina of the rectus sheath is deficient, where the rectus abdominis muscle is directly lying on the fascia transversalis, that too from the below the level of the arcuate line. And here you are seeing another small muscle here called as the pyramidalis muscle. So this is all about the rectus sheath. And now coming to the clinical importance of this rectus sheath, I'll do like this. I'll just cut it a little bit, and I will just try to see it like this. Yes, I'll just now you can see that on the inner surface or the posterior surface of the rectus sheath, there are, you can see few vessels, right? Blood vessels. The other one is here, right? You can see at the level of the arcuate line only, you will see another one. But okay, we are not seeing in this cadaver. Here it is, right? Right here we are seeing this one, right? So in the upper 1/3 of the rectus sheath, posterior surface of the rectus sheath, here we will be seeing one artery called as the superior epigastric artery. And now from the level of the arcuate line, there will be another artery, one artery which will be piercing here called as the inferior epigastric artery. So the rectus sheath contains two muscles, namely the rectus abdominis and the pyramidalis. Am I correct? Correct? Two arteries, the superior epigastric artery and the inferior epigastric artery. Two veins, the superior epigastric vein and the inferior epigastric vein. And also nerves, especially this rectus sheath will contain the nerves which belongs to T7 to T12. T7 to T12. These are all the contents of the rectus sheath, right? This is all about it.